A surgeon is resecting the medial segment of the middle lobe of the right lung. Which of the following is the correct characterization of a bronchopulmonary segment? Looking at the option, we need to define a bronchopulmonary segment. Let's look at this lateral chest x-ray with a contrast showing the bronchial tree. So this is a bronchogram. In the lung, there are segments, 10 segments in either the right lung or the left lung. There are segments, and these are called bronchopulmonary segments. These segments roughly are pyramidal in shape. They have their base at the periphery of the lung, and the apex of the pyramid is toward the hilum of the lung. And each segment has its own supply of a bronchial tree, that's a segmental bronchus, its own branch of the pulmonary artery, its own branch of a bronchial artery, its own lymphatic vessel. But the veins, the pulmonary veins, are located at the borders. So each pulmonary vein drains more than one segment, while a pulmonary artery supplies only one segment. A bronchial artery supplies only one segment, and a segmental bronchus supplies only one segment. Now let's look at the options. A bronchopulmonary segment, medial segment of the middle lobe. The middle lobe, by the way, the middle lobe of the right lung has two segments, a medial segment and a lateral segment. So the medial bronchopulmonary segment of the middle lobe of the right lung is supplied by a secondary or a lobar bronchus. No, it is not supplied by a lobar bronchus. It is supplied by a segmental bronchus, because the lobar bronchus supplies a lobe. It supplies the middle lobe itself and then divides into medial and lateral bronchopulmonary segments. So this option is wrong. Its base is directed toward the hilum of the lung, as we have just seen that the bronchopulmonary segment is pyramidal in shape and its base is directed toward the periphery of the lung. It's the apex that is directed toward the hilum of the lung. So this option again is wrong. Is separated from the lateral segment of the right lobe by parietal pleura? No, it is not separated by parietal pleura. In fact, the parietal pleura encloses the lung, covers the outer surface of the lung, and it does not extend into, even it does not extend into the fissures of the lung. What extends into the fissure of the lung is the visceral pleura, not the parietal pleura. And even the visceral pleura will not form a partition between the segments. The visceral pleura will form partition between lobes of the lung by extending into the oblique fissure or the horizontal fissure in cases of the right lung, but it does not extend between the segments of the lobes to separate in between them. So this option is wrong, even if the visceral pleura was mentioned instead of parietal pleura in it. D, its arterial supply is in common with the posterior segment of the upper lobe. As I mentioned, that each segment has its own blood supply, arterial blood supply, whether a bronchial artery or a pulmonary artery, and does not share this with the adjacent segments. What is shared between the adjacent segments is the vein. So its vein may be used to localize the plane of resection between segments. The vein, the pulmonary vein, is located at the periphery of the segment. It is shared in between these two segments, and because it is located at the periphery of the segment, then it might be used to localize the plane of resection between the segments. If a surgeon is intending to do a lobectomy, for example, resecting the middle lobe, the whole middle lobe, then this would be much easier, because the middle lobe of the right lung would be bounded by the oblique fissure and the horizontal fissure, and these will act as a very good and easy plane of resection of the whole lobe. But we are talking about a segment of a lobe, and in this case the veins which are located at the periphery of the segments, not necessarily the medial segment of the middle lobe as what has been mentioned here in this question, but any segment of the lung, the veins can serve to localize the plane of resection of the segment, because these veins are located between two adjacent segments, and in fact they drain the two adjacent segments.